Hello, my name is Shavonda Jackson. I am a BSN student with Indiana State University. Today we will be talking about protecting the unborn child, fetal alcohol spectrum disorder. The population at risk will be women of a reproductive age of 18 to 44. Could you please take a moment to complete the pre-test before going on with the presentation? And there will be a post-test at the end of the presentation. Thank you. Learning objectives. At the conclusion of this presentation, participants will be able to define fetal alcohol spectrum disorder, recognize and give examples of the negative effects of drinking alcohol while pregnant, identify preventative measures that are available to prevent harm to the unborn child, define and explain binge drinking, identify the attributes that a child will exhibit with fetal alcohol spectrum disorder. Fetal alcohol spectrum disorder. Definition: a group of abnormalities that an infant suffers from when the mother ingests alcohol while pregnant. There are several disorders associated with fetal alcohol spectrum disorder. Fetal alcohol syndrome results in physical, behavior, and cognitive defects. Partial fetal alcohol syndrome does not exhibit all the deviations that fetal alcohol syndrome does. Alcohol-related birth defects. Some of the physical abnormalities are there. No behavior or cognitive losses are exhibited. Alcohol-related neurodevelopment disorder. Abnormal behavioral cognitive growth with normal development. According to the Centers for Disease Control and Prevention, screen and intervene to reduce binge drinking. So binge drinking can be defined in a woman as 4 alcoholic beverages on an occasion in about 2 to 3 hours. 4 in 5 adults who binge drink were not advised to reduce drinking by a healthcare provider. So we as healthcare providers have to do our part to educate the community regarding binge drinking or regarding responsible alcohol intake. Primary care providers can make a difference by screening all adults, provide feedback about health risks, work together to reduce drinking if a patient desires. And with that being said, it has to be the patient's choice. We cannot coerce the patient. We cannot pressure the patient. It has to be the patient's decision. But we have to inform them that binge drinking can cause injury, disease, and death, and definitely harm to an unborn child. Statistics related to fetal alcohol spectrum disorder. 54% reports drinking in the last 30 days. 18% reports binge drinking. Alcohol is a tetragen to an unborn child. Universal screening is to be completed on all clients by a healthcare provider. 50 per 1,000 children are affected by fetal alcohol spectrum disorder, approximately 1 in 20. These statistics are considerably higher than those who suffer with autism. 14.6 per 1,000 children suffer with autism. 1 in 1,000 children suffer with Down syndrome. Fetal alcohol spectrum disorder is least common among the disorders listed. Negative effects of fetal alcohol spectrum disorder include motor problems, complications with seeing and hearing, cognitive deficiencies, difficulties focusing and staying engaged, autism, mood swings, social incapacities, and limited impulse control. The attributes associated with fetal alcohol spectrum disorder are shown in the pictures listed. For its facial is undeveloped brain development. They may have kidney issues, slow growth. Some may have a low nasal bridge, a short nose, a small mid-face, a thin upper lip. They may have deformed joints. Of course, we've noted on the vision and the hearing problems, but they may also have heart disorders. So this can affect an infant, but it will affect them for the rest of their lives as well. Gestational harm. Definition: in utero harm that occurs as a result of the pregnant woman herself. Types of gestational harm are lethal, which leads to miscarriage or in utero fetal death. Non-lethal, harm to the fetus or future child. Fetal alcohol syndrome disorder is a type of non-lethal gestational harm, and it is the most preventable type of non-lethal gestational harm. This is in reference to Wilkinson et al. This chart displays that there is no safe time, no safe amount, no safe alcohol during pregnancy, period, because the impact it can have on fetal growth and development. Preventative treatment. An SBIRT is screening, brief interview, and referral for treatment. This screening is to be performed by a healthcare provider. It helps to assess for substance abuse, alcohol, any type of drug use. Also, it is like a reference to help direct what type of treatment we would want to send the patient to. Educating the client regarding the importance of not drinking is vital for the health of the unborn child. Treatment is intimate if substance abuse is detected, yet it is up to the patient to consent for treatment. Legal aspects. An unborn child has no legal rights in utero. A fetus is not considered a person. A mother can drink alcohol while pregnant and pass fetal alcohol spectrum disorder to the unborn child. No legal consequences for the mother while child is in utero. Once the child is born, the legality shifts for the mother, and she can be charged for harm to the child. The child can then be removed from the mother for safety and protection. I hope you have enjoyed my presentation. There will be a post-test at the end of this presentation, and there's a brochure for you to view with information and references listed as these references here are listed below. Thank you.